The Edo State government, through the Ministry of Local Government and Chieftaincy Affairs, in collaboration with the 18 local government councils and the Edo State Primary Healthcare Development Agency, has officially flagged off intensified community health activities aimed at curbing the spread of infectious diseases across the state. The zonal flag-off ceremony, held on Friday, 28th of November 2025, took place simultaneously in Edo North, Edo Central, and Edo South. The coordinated approach is designed to deepen community engagement, expand public awareness, and strengthen statewide responses to diseases such as dengue fever and diphtheria. The initiative places strong emphasis on health education, early detection, and active community participation as key strategies in disease prevention.
We are going to vaccinate 9 months to 14 years. We all know what measles is all about before. That measles itself, the rash itself is not what the disease is about. There are the complications that follows the rash, or rather the measles. That is what it is not too good, because it is deadly. It can cause a lot of things. It can cause pneumonia. It can cause blindness. It can cause deafness. So don't just say common measles. So this time around, the rubella we are adding to it, with survey that has been carried on and with surveillance that have been on since, we have discovered that apart from we having measles, we still have what we call rubella. And the signs and symptoms is not too different from measles.
Speaking at the event, the Executive Secretary of the Edo State Primary Healthcare Development Agency, Dr. Kusin Oraimire, represented by the Director of Disease Control and Immunization, Dr. Eseigbe Efeomo, underscores the critical role of preventive health education and community vigilance in safeguarding public health.
Dengue fever is transmitted by mosquitoes, and dengue is caused by virus. Its symptoms look like malaria symptoms. So many times when our people have fever, they just present in a health facility and start treating for malaria. So if they do all this, these diseases are actually preventable. And we all know that prevention is better than cure. So we are very thankful to the Executive Governor of Edo State for the enabling environment he has given us to be able to impact our communities.
Also speaking, the Kobaoka Local Government Chairman, Honorable Sino Sawaru, represented by the Secretary of the Local Government and Managing Director of the Edo State Parks and Garden Agency, Pastor Stanley Dave Igodalo, urged residents to remain alert and proactive amid rising cases of mosquito-borne and respiratory infections.
There is this saying that health is wealth. And I thank God that we are taking enough health as a big challenge in our states. And thank God the local government are also part and parcel of this organization. He talks about mosquito and all that. Please, we should try as much as possible to keep our environment clean. I believe that can also avoid mosquito bites and all that.
In the Edo State Parks and Garden, if you walk around town today, you see how much we've done with vegetation control around the state to avoid some of these mosquito bites and some other challenges. And effectively, of course, His Excellency has also mandated us to make sure various board has what we call green areas to also manage erosion. A well-managed erosion is where it's good for our environment. Is the effectiveness, the first proper channel to distribute most and some of these items, and more also education, not just here in Kobaha or here in Ubelu. We should be able to visit key health centers around the local governments across Edo South to be able to educate them.
Beneficiaries at the event expressed gratitude to Governor Mondo Pueblo for prioritizing healthcare in his administration, describing the initiative as timely and impactful.
From all that was taught about the outbreak of the dengue fever and the measles, the rubella that is transmitted by malaria, the Aedes malaria to be precise. And then we're taught about how we can prevent this through vaccination and also by keeping our environments clean and being hygienic.
I want to especially thank the Executive Governor of Edo State, Senator Modu Beolo, for his support for healthcare development as far as Edo State is concerned. And today we were called upon that we should come and get the information regarding dengue fever, and other and rubella vaccine, measles vaccine. And we also thank the governor that he also shed free mosquito nets to enable our mothers to have a good sleep, so that mosquito will not be biting the children, so that we'll be free from this dengue fever, specifically because it's caused by mosquito.
Treated mosquito nets were also distributed to nursing mothers, courtesy of Ministry of Local Government and Chieftaincy Affairs, as part of efforts to reduce mosquito-related illnesses. The Edo State government continues to encourage citizens to support the campaign, cooperate with health officials, and adopt healthy lifestyle practices to promote safer communities. In Benin City, Osamu Jame Kennedy reporting for Afema Reporters TV.